Welcome to the 2026 Medicare Crisis Series. I'm Matt Ferret, and for decades, I've been inside the Medicare industry, so you don't have to. In this series, I'm unpacking the biggest Medicare shakeups around Advantage, Part D, and supplements, and showing you how to survive them. When people think Medicare is in crisis, the headlines are all about Medicare Advantage plans disappearing and service area reductions or drug plan premiums spiking during the annual election period in the fall. But here's what nobody's even talking about. Medigap premiums are going up too. And for many people, that's a much bigger financial hit than losing a dental benefit or paying a higher drug deductible. Have you already seen your Medigap premiums go up this year? Drop the percentage in the comments. Let's see who got the biggest increase. Medigap, also called Medicare Supplement, plans are designed to cover the gaps in original Medicare Parts A and Part B. They're steady, predictable, and don't change benefits year to year like Advantage plans do. But there's a catch. The premiums go up every year. And in 2025, those increases were bigger than usual. According to CSG Actuarial, the average Medigap rate increase in 2025 was over 10% across all plans. Plan G, the most popular plan, saw average increases of more than 12%. And many companies pushed through double-digit hikes, with some as high as 15, 20, I've even seen 25% depending upon the state. And here's something most people don't realize. These increases don't hit during the fall annual election period. They come in the spring or the summer, after most people's Medigap open enrollment has long passed and after you can easily move to a Medicare Advantage plan in the AEP. In other words, they time the increases when you're stuck. Carriers don't roll these increases out in the fall when everyone's shopping during the annual election period. They wait until spring or summer when most people, again, can't easily switch. That timing isn't an accident. So, why are Medigap premiums going up so much? There are a few reasons. Number one, healthcare inflation. Inflation. When hospitals and doctors charge more, insurers pass those costs on. It's as simple as that. Number two, older customers. The longer you've had a Medicare supplement, the more likely you are to actually use it. And when more people in a plan are using it heavily, the company raises rates for everybody in that plan. Number three, shrinking competition. In some states, fewer companies are selling Medicare supplements, so there's less price pressure. Number four, Plan G is the new Plan F. Plan F closed to new people all the way back in 2020. Those enrollees are aging, using more health care, and their premiums have jumped. Now, Plan G is basically the new Plan F. It's the richest Medigap plan available. If you know you're going to use your insurance, you buy Plan G. And 5 years in, those premium increases are starting to look just like what happened to Plan F. It's kind of like an all-you-can-eat buffet. The people with the biggest appetites keep showing up, and eventually the restaurant has to raise prices for everybody. And here's the kicker. Remember in episode 2 when we talked about Part D? Medicare dumped billions into drug plans to keep premiums from exploding in 2025? There's no bailout for Medigap. If you're in Plan G, those increases come straight to your bill. This matters because for a lot of people, Medigap isn't optional. It's the backbone of their coverage. But rising premiums force tough choices. Do you downgrade from Plan G to Plan N to save money? Do you shop carriers for a lower rate? Or do you consider moving to Medicare Advantage with all the network restrictions and benefit changes we've been talking about in earlier episodes? Have you ever switched Medigap carriers to save money? How much did you save? And was it worth the hassle? Share it in the comments. All right, so what can you do if your Medigap premiums are climbing? Well, number one, shop around. Same benefits, different price tags, sometimes big savings. Number two, know your state's rules. In many states, switching Medigap plans means answering health questions, but if you're healthy, it's worth checking. Number three, consider Plan N. It can be a good option to lower premiums, though you'll have some copays and possible excess charges to deal with. Number four, don't just accept increases. Ask questions, compare options. Don't just sigh and pay the bill. Number five, think long term. If you're still in your Medigap open enrollment, that's the first 6 months after you enroll in Medicare Part B, make the right choice now. That's your golden ticket to guarantee coverage without health questions. If you want to stay ahead of Medigap premium hikes and all the other Medicare changes I've been breaking down, join my free newsletter at prepareformedicare.com. That's where I share insider updates, strategies, and what's really happening in Medicare before it hits the headlines. And while you're here, hit subscribe so you don't miss the rest of this 2026 Medicare Crisis series. This was part 5 of my 2026 Medicare Crisis series. Check out the playlist below for earlier episodes and subscribe so you don't miss what's next. If you want personalized help, my wife Nikki and her team of licensed agents at brickhouseagency.com offer free, no-obligation consultations. Remember, there's no obligation to enroll, and they don't represent every plan available in your area. I'm Matt Ferret. Here's to your wealth, wisdom, and wellness. And trust me, this won't be the last Medicare shakeup.